speaker will be our CEO, Dr. Anmol Kapoor, on advancements in cardiology for longevity.
Thank you so much. Really appreciate it. How's everyone doing right now? Still here? Not sleeping? Okay, that's good. Well, I'll try to wake you up a little bit. I don't have much slides. I go through quite fast. So heart is my business, and my job is to make people live longer, if they want to live long. If is a huge if. Most people don't want to live long. Most people don't want to live a healthy life at all. So by the time I see them, it's too late. So and they want everything possible at that time, and not much I can do, or any cardiologist can do. So our goal becomes to manage the disease, and that disease is going to kill them eventually one day. Some people die earlier. Unfortunately, death has been a part of the story of cardiology, and survival the part of the story of cardiology. Tell you a story before I start my presentation. From my residency days, cardiology, was doing a CCCU call, and an old lady came in by passing out in emergency room. I was a fellow at that time, learning how to do medicine from a cardiac perspective, and she was passing out, and the emergency called me to check her out and see her heart was stopping for a few seconds. So obviously she needed to be taken to CCU for monitoring, so we can put a permanent pacemaker the next day. So the pacemaker team is home, and it's nighttime, so I have to monitor her. So I take her there, being the only person responsible at nighttime, and put a small flimsy wire, we got temporary pacemaker, just to keep her going at that time, because she was passing out. In the morning, the pacemaker guys will come in, put a permanent pacemaker, and we were able to get her home. So what was happening, every few minutes or a few hours, she would die, and the code blue, I would run to CCU, the wire will move, it's a very flimsy plastic wire, so I adjust the wire, she will be alive, so Dr. Kapoor, I'm here, and then I go, she die again. So the whole night I was like that, death and life, okay? So then I had to call the IEP guys, like the physiologist guys, they have to come in the morning. So, well, we have to come at 8. I said, no, come at 6 at least, call nurses earlier, because no one wants to come earlier. So she's dying all the time, right? She died 5 times in front of me. So we have to do something. So they come early, have a permanent pacemaker, she went home. So yeah, so life and death is a part of the story. And that's what fascinates me about precision medicine, because that's what gives the foundation of longevity and the bioarrow. Because we truly have to find solutions. Death is inevitable, but we want to delay it as much as we can. And heart disease is the biggest killer. It kills more people every day, every time, and they're happening in minutes. Like in Canada, so many heart attacks are happening all the time, and premature right now, and at much, much younger ages. So the goal is what the AI can do, what technologies are out there in cardiology, what could be up on the horizon. It's very important to talk about that. We talk about various lifestyle modifications. We talk about what are the interventions we can bring in. But I think the personalized cardiology is going to change. Many times patients come to me and ask about heart failure. Why do I have a heart failure? Why I got a blockage in the heart artery at a young age, but not my brother or sister. So answer is always idiopathic. I don't know. Idiopathic in medicine means doctor's an idiot, patient's a pathetic. Truly, it's true, because doctor has no idea. Doctors call it idiopathic. Idiopathic pulmonary hypertension means I don't know. So instead of accepting it, you don't know, you just call it medical term, idiopathic. So this is what it is. Idiopathic heart failure, idiopathic heart disease, idiopathic sudden death, idiopathic arrhythmia. Anything you don't understand, call it idiopathic. It's easy to get out. This is how the medicine has been, seriously. And to all of you guys, non-doctors, look very smart, but it's not. So it's an easy way for us to get out as the doctors. But there's a story. That's what we need to know, which genes are acting, why someone has a hyperlipidemia, why someone has a sudden death, why someone is passing out, why some people with COVID vaccine got myocarditis, but not the other ones. Why some people are dying from blood clot from COVID vaccine, but not the other ones. It's genetics, genomics. It is the world's largest real-time genetic clinical trial that happened. You gave a random drug to people, everyone got it, and some people got the complications, and we found out those people had certain genes. So that's where genomics comes in play. Not everyone had those genes. So vaccine wasn't that bad, it just vaccine helped us find those genes, those people who were developing the disease. They would have developed the disease either way. If not from this vaccine, maybe some other vaccine, maybe from the virus in itself. So it's just because they have a predisposition. So it's very important to understand how environmental factors and the personalized drugs needs to be delivered through pharmacogenomic approaches. So early detection is very important. Blood pressure alone, as a measurement perspective, if you can manage your blood pressure more accurately, perfectly, you're going to live 6 years longer. Okay, just hypertension alone. But most machines the doctors are using are not clinically validated. The machine you buy on the store, online, or in a grocery store is not clinically validated. It has a 5 to 10 millimeter mercury difference. It's 130, it could be 125, it could be 130 or 40. So number could be anywhere. It's just a trend you're looking for. So we end up developing one of the technology, blood pressure monitoring, clinically validated, AI, analyzing the data, interpreting the data, getting reported in clinical time. We have done over 9,000 tests in Alberta. So our goal is to get 100,000 people analyzed in Alberta with real-time blood pressure monitoring. We discovered 45% people in Alberta have a sleep apnea predisposition. 45% roughly around people don't even know they have a high blood pressure. So there's a lot of awareness lacking. So it's very important to deploy the right tools. Early detection is very, very important. Apple Watch, Fitbit, wearable, everyone has it. I'm sure some of you guys have it. But the question is, what else we can do with them? They are good in picking up arrhythmia, but you need to show to the doctor. So doctors need to have an access to those things. Holter monitoring is becoming quite real-time monitoring. So not just having a reactive monitoring, you take a machine home, bring it back. In Alberta, the government doesn't want that program either way. They paid $25 for the cardiac monitoring for 24 hours. And Red Deer cardiology program shut it down because it's not worth it anymore. And there's no other billing code to use it. But real-time monitoring is becoming quite popular, where doctors can monitor you the way monitoring in the hospital, the nursing unit. Same way you can monitor a human for 30 days and watch them. Someone's watching them in real time. We are watching real time to see what arrhythmias they're having, and so the ambulance go there, and the real-time intervention could happen. So they're already going on. Those innovations are happening in cardiology. Yes, not in front of you in Calgary, but they truly are going on right now. And so diagnostics from an early detection perspective. So how is AI diagnostic helping us? It is helping us with the accurate CT scan measurement, MRI scanning, the right AI tools, radiology is getting maximum exposure from it. But something cool we launched in Dubai is Biongevity app. Technically, it is live in Calgary too, but we are open it up to many people. The first time globally, you can get your facial scan. In 2 minutes, you have to hold your camera, you get your blood pressure and heart rate. And we built the technology, many people didn't believe it in my own team. In Dubai team also didn't believe it. Is it accurate? I said, go check your blood pressure monitoring. They deployed a BP arrow, and the number coming out, because we can adjust the settings, and they could really see the number is so accurate. So we deployed that. Air quality index, we deployed that. This is part of the puzzle of the Biongevity app. So it tells you how many days of lifespan you're losing every day. You're going to breathe the wildfire air outside in Calgary in the summertime, or the bad smog in New Delhi, so that it calculates all those days for you. So the longevity AI is how it's coming in your hands in the everyday basis. We are delivering it as a company. And we're going to deliver it to you with a much more powerful emotional stress analysis. You're happy or not happy today, and what could be triggering the risk for heart disease. So we can tell you way more from your facial scan than you can even imagine. But we don't take your picture, so don't worry about it. So we just take the data, share the data with you to help you live longer. And all the variables fit with Apple Watch monitor you all the time and guide you to become your better person. So we can truly get better in control of heart disease. And biomarker detection, before I go, something cool we are developing. Okay, where's my back? Okay, yes. Something we're developing called from CardAI. The biggest challenge has been cardiology. Can you diagnose the troponin, which is a cardiac biomarker for a heart attack, and NT-proBNP, which is a biomarker for a heart failure? So usually you have to go to emergency room, stuck for 8 hours until the second test is negative, they'll send you home. That creates a waitlist in emergency room. So we are the first company deploying this technology. Next year you'll be able to, hopefully, if health now approves it, otherwise other countries will be first. You'll be able to detect a heart attack biomarker in 15 minutes from your home. You'll be in a plane, having a chest pain, drop your blood in a small cartridge, open up your iPhone camera, and then we'll be able to tell you the level of antibodies, the level of troponin, NT-proBNP, even your pregnancy data can be shared that way. Not just a positive negative, it can even tell you if pregnancy is becoming successful or not. The technology can be deployed in many different realms. So our company is bringing those technologies using AI to help disrupt the cardiology side. So regarding AI prediction tools, BioELR, the world's first longevity health record system. And there's a graduation happening from paper records to EMR records to EHR records, semi-smart, now full smartness happening. So AI is literally monitoring today any patient into the system. It reads a note from radiology, so make sure doctor doesn't miss it. It's a problem. Right now, many people were sent for angiogram and heart ultrasounds and bunch of those things. I will see the report when I'm in the clinic. Otherwise, person can die. What more I can do? There's a system right now. But now AI can help me read those notes and help make automatic appointments. People who may be at risk, radiologists recommended to do an MRI or CT, book them early appointment, nudges me. So it helps me along the way. So now doctors have more time, less anxiety, less stress in doctor's life. We can focus on clinical care. That's the BioELR capabilities we can deploy today if someone would like to do it. Wearables definitely are changing as we are. Biongevity does monitor you, nudges you how many steps you're walking. In fact, we launched in Dubai the world's largest longevity fitness challenge for 9 million people to participate. Let's see how many participate with the wearable, and people will be getting rewarded how many steps they walk every day. And top 25 people get a complete longevity assessment worth over $25,000, $30,000 US. And get them insights because they're committed. They walk that much steps. You have to walk every day. If you're not walking at 1 hour every day, you're going to die earlier. So run like it's a medication. Your life depends on it. So make sure you walk every day. Stay active. That's very, very important. That's the best medicine. So in cardiology, yeah, something cool happening is leadless pacemakers. So pacemaker big wires. Remember I was putting in initially? So we don't have to put in those wires anymore. We can plant small pacemakers right in the heart now. So you don't have to do major heart surgeries anymore. You can put some valves inside with a percutaneous leak. So cardiology is changing. Not the same when I graduating many years ago. And a lot of surgeons are jobless because of it, sadly. Not much you can do there. But this is how it happens, right? So innovations in cardiology, you have to understand what really is happening in economy. Stem cells, quite promising. But we are not there yet in cardiology. So we had hit trials, failure trials. We have more failures than we have more successes. But I think we are understanding the power of genomics, who's the right candidate, and what's the right time to have a stem cell be able to help patients with heart failure or heart disease. I think it's going to be soon with the new administration in the US. So there'll be more push happening in the stem cell area. So let's see some real-time big trials. And we'll be able to gather some more information in that way. CRISPR, I love CRISPR, and Cas9, Cas3, Japanese versus Americans play right now, and most people don't understand the difference, but in a summary, we truly can cure the disease. Clinical trial happened recently where people with high cholesterol, blockage in the heart arteries, can't tolerate the medication, they switched off the gene, and that was contributing into blockages. It was a very successful trial. For the patient population. So in the future, we'll be able to switch off the gene. You'll never have to take a statin, never have to take any medication in that regard. Just imagine that. And we can switch off the gene that could put you at high risk for arrhythmia, switch off the gene that could be causing the hypertrophy in the heart. Just imagine the power. We'll be able to make people live longer for a long, long time. So that is the reality. I'm very excited about that. And we as a company will be also spending time in that area. The last slide. So nanotechnology is also shaping and helping us in cardiology. will be able to bring 3D printing and organ regeneration is becoming reality these days. Fake hearts, some field experiments happen lately in USA and Europe, where the hearts were grown in a lab, implanted in someone's body, didn't last as long, but that's okay. These are earlier failures. The way satellites were falling down, the planes were crashing early time, same way happening now in this area. We'll be able to grow the good hearts that is going to help power you. Even your normal heart is not working at that time. It's coming. It's just when we don't know, but it's a matter of time. It's coming soon. Something cool we built, Panomic, real-time, the world's only company with this technology, real-time genomic analysis. It's needed. So when you're in front of me as a patient, you're asking me, Dr. Kapoor, tell me aspirin is good for me. Should I take a statin? I heard bad things on the internet. Some big speaker was saying statins are bad, or this drug is bad, I want to take it. But I don't know if it's good or bad for you, so I'll say based on the population data, try it. But if you do a pharmacogenomic analysis real time in front of me through mobile application, I can truly prescribe medication that matters, that help you. So that is true, and that is happening in cardiology, slowly by slowly, globally. In UAE, they have taken a lead. UK has been investing money in this area. Other companies are coming along. It's going to happen. No more hit and trial approaches in that regard. So cardiology is changing, and it's not changing just presently in front of you, but in the background, a lot of changes are happening, and more going to happen over the next 5 to 10 years. Thank you.